Good evening. Dumelang. Thank you. Dr. Med will come clarify. Dr. Tedros, I know this is something that you know as well. Dumel. Middle of the road, but we'll let you go. We'll let you get away with that. Sanbonani, I'm from South Africa. Oh, hello. Hello, fellow South African. And there's another one. Did you vote? Just by the way. Yes, you've got your mark. There's proof. I voted in secret, so you won't see anything. Ladies and gentlemen, honored guests, Dr. Tedros Ghebreyesus, the Director General of the World Health Assembly, the Regional Director of the World Health Assembly Africa, Dr. Matshidiso Moeti, our honored partners and ministers of health who are gathered here today, all protocol observed, all being protocol. A very warm welcome to you to this very, very important event. We are observing a momentous milestone here at the Beau Rivage Hotel, 10 years of transformation, improving health of the people of Africa. We talk about health for all, and this is what we're here for today. We'll be looking back at the past decade. And this is what this event is about. It will be over 2 hours, and in 2 segments, we'll give you a little bit more detail. Just please be aware, it is streaming live on air, live on socials as well. So if you are trying to find yourself wherever you are and you're not seeing yourself, you are there. It's just a lag of 30 seconds. You can relax. We have you. You are recorded. So we are going to hear keynote remarks from the WHO and its partners. We're going to have reflections from 5 African ministers of health on the significant progress that they've made in improving health and the conditions. We know that it's been the past couple of years apocalyptic, almost, some of the challenges that we have faced. Just a few housekeeping rules. There are assistants in the room. So as I mentioned earlier on, if you need some translation gadgets, the headphones are there. Put your hand up and we will match you up with one. French is on channel 1, English on channel 2, Portuguese channel 3. Now you're wondering, who is this lady who's talking so much and does not at least introduce herself? I think I'm very important because I think I actually have somebody who's doing that for me. So ladies and gentlemen, please allow me to introduce my co-host, Raisa Okoy. She is a broadcast journalist. She's worked for several international media in Europe and Africa, such as BBC, Forbes, Africa Magazine, or Magazine, Vox Africa, French television. She's based in Dakar. Raisa calls herself a daughter of the Congo River, where her heart is rooted. Please give her a warm round of applause.
Thank you very much, ladies and gentlemen. I'm very pleased to be here today, share the stage with so many important people who are transforming lives, not only here, but everywhere, especially in it's really near to my heart, Africa. So the lady who introduced me, a very well-known lady, as she said, she's from South Africa. She voted, so she's a good citizen. Tepiso Makwetla, she's news current affairs broadcaster from the SABC, the South African Broadcast Company. She's a Bill and Melinda Gates Foundation 2023 goalkeeper, MNCH and SRHR activist working at both AU and UN level. Tepiso is brilliant, really honored and flattered to be here with her today. So for the housekeeping rules, I think you've heard it all. We can pick it up now. What do you think?
Money in the bank for you for all the right things that you said.
Now, ladies and gentlemen, I hope you're comfortable sitting or standing, for those of you who are standing, and ready to watch a video that's going to set the scene for us and remind ourselves how far we've come.
We are becoming a WHO that our stakeholders want. By making the most of our resources and expertise, we are creating sustainable positive change, increasing impact, and cementing trust as a promising partner.
In the most recent past, we had a major outbreak of Ebola in Uganda, which started in the middle of the country. And we were able to respond to the epidemic to an end without keeping l'organisation de la santé est acceptée de nous accompagner dans le but de development resource as a government, we've been a lot of demand, and we have the liberalization also of our education system. And most of this has been more or level as a manufacturer that has
Both medical and paramedical students have benefited. So that is human development, which can never be overemphasized. Because what makes the country is human. Universal health care coverage means that people can access the services where they are in the nearest possible area, but also reducing the cost for the person to get to those services.
Part we have, we are then a part of impact that make all the difference in the lives and livelihoods of Africans and people around the world.
We are proud to be the WHO transformation trailblazers, influencing change that is not only making a difference, but inspiring us.
I hate to say it, but that applause is a little bit weak. We are here to celebrate 10 years of stewardship, celebrating the vision, the hard work of Dr. Matso, the visual director, the executive of WHO Africa staff, the vision, that transformation agenda journey, Dr. Mweti launching in February of 2015, saying that on the assumption of office, that she wants a program that would represent a vision for health and development that aims to address the unacceptable inequalities and also see the enjoyment of the highest standards of health that is underpinned by the transformation agenda. Lots of progress have been has been made. You'll hear from countries. And I'd like to introduce the next speaker, who and when I say this, it's not brown nosing. This is a table of some of the nicest people that I've met in the world. Honestly, they are effective, they are very firm, but nice people. And so is the next speaker, because I remember moderating a session with him last year, Dr. Austin Demby, the Sierra Leone Minister of Health. And he's got a very nice, gentle voice. But when he brings up his points, he's very firm. So please allow him to come and tell you a little bit more about the progress that's been made in his country. And Comma, like that program, it speaks to a continuation of something, particularly to do with women and maternal health rights. Please give him a warm round.
Well, thank you very, very much. This is a family gathering, and I was hoping that we could do this in a very relaxed atmosphere and ad-lib it. But I got a script, so I may have to read off the script. So the WHO Director General, Dr. Tedros, Her Excellency, the WHO Regional Director for Africa, Regional Director for Afro and AMRO, the Honorable Ministers of Health from Africa and beyond, Excellencies, ambassadors, and heads of diplomatic missions, representatives of government globally, staff of the Secretariat, representatives of developing partners, colleagues from the UN. I welcome you all to this momentous side event, a testament to our collective achievement and the transformative impact we've made in public health in Africa. On behalf of the government of Sierra Leone, I thank the Regional Director for Africa, Dr. Moiti, for allowing Sierra Leone to co-host this event that celebrates the milestones and accomplishments in public health in Africa, the transformative agenda. The Secretariat's reform over the past 10 years has been transformative, and Sierra Leone has reaped the benefits. These reforms, guided by the powerful and comprehensive transformative agenda TA established by the regional director, have reshaped our approach and ensured our effectiveness. The TA is not just a framework, but it's a beacon of inspiration, driving us to deliver on our missions and our mandate to the member states. Over the years, the Secretariat has acted on a number of stated activities and needs and reaching to a dynamic health aid. I want to reflect on the Secretariat's putting people at the center of change, such as our collective vaccination response to COVID-19, while working with member states to deliver quality results and value for money to save lives of millions. In 2022, Sierra Leone witnessed firsthand the Secretariat's support to the public health needs that were beyond the capacity of the government and that required concerted efforts. For example, during the fire incident that saw hundreds injured and scores of others dead, the Secretariat response was swift and comprehensive. It dispatched and deployed the necessary skilled personnel within 24 hours, including burn management specialists, and airlifted 6.6 tons of medical supplies to Sierra Leone. These supplies were crucial in treating hundreds of severe burns cases, demonstrating the Secretariat's commitment to saving lives and protecting public health. The COVID-19 pandemic has been a significant learning experience for Africa. It highlighted the importance of vaccine rationalization and response, areas where many African countries were left behind. These lessons have strengthened our preparedness in terms of coordination and capacity building to ensure that we are better prepared for the next pandemic. WHO's well-coordinated response and coordination of other stakeholders were instrumental in preventing overlaps and duplication of efforts, while delivering the most urgent assistance, leading to minimal deaths in Sierra Leone. The sharing of knowledge and best practices between countries and organizations facilitated by the Secretariat was crucial in improving the quality of our response to public health emergencies beyond COVID-19, Ebola, and others. Through the support from the Secretariat, with the Transformation Agenda vision, WHO supported the government of Sierra Leone to establish a National Public Health Agency. This agency plays a crucial role in the coordination, preparedness, and response to public health emergencies in the country. The Secretariat also supported piloting the Universal Health Preparedness Review, UHPR, by launching it, further demonstrating its commitment to improving public health preparedness. Other than over the last 11 years of war, armed conflict, and later the Ebola outbreak that devastated the country, Sierra Leone also suffered a series of serious health emergencies, mainly disease outbreaks and natural disasters, including COVID-19, measles, polio, floods, and mudslides. WHO support was instrumental in coordinating and responding to the crisis during the Ebola outbreak. The TA vision presented opportunities for Sierra Leone to implement the UHPR, the flagship in liaison with the government and the Ministry of Health. WHO ensured complete transparency, swift response with medical supplies, capacity building, and others, which greatly strained the health system. Support for other African countries, particularly within the Mano River Union, with personnel and supplies to respond to emergencies in the Union countries, a testament to the effectiveness of the transformation agenda. Identification and training of more than 100 responders ready for real-time deployment nationally and internationally to respond to emergencies. Partnership with national health authorities in Sierra Leone and other neighboring countries to coordinate and timely deploy emergency responders, which ensured effective and prompt deployment of responders, a testament to the effectiveness of the transformation agenda and the commitment to the national health authorities to public health preparedness. As a responsive, results-oriented, accountable secretariat, WHO is working closely with the Ministry of Health to advance the client-centered life stages approach in Sierra Leone. A demonstration site has been identified in Moyamba Government Hospital and community health centers to serve as pilots for the client-centered life stages approach for the other sites of the country. These centers will enable persons of all ages to access consumable and comprehensive healthcare services of their different ages. The recent global mortality estimates indicate that Sierra Leone has reduced maternal mortality ratio to 443 per 100,000 live births by 2020, up from 1,165 per 100,000 live births in 2013. Sierra Leone has also seen a decline in child death from 220 per 1,000 live births in 2001 to 105 per 100,000 live births in 2021. Despite these efforts, Sierra Leone remains one of the countries with the highest MMR in the world. In this regard, the Ministry of Health declared MMR an emergency in the country to allow for more focus and resource allocation locally and internationally to reduce the burden. A call to all guests is to continue to leverage these achievements and build on them to respond to the public health needs of our populations, knowing that member states have the full support of the Secretariat. Thank you very much.
Thank you very much, Dr. Austin. As my colleague said earlier, we feel like you guys are a bit shy. You can applaud for Dr. Austin. I can't hear you. Thank you very much. Now it is my great honor and pleasure to give the floor to Dr. Tedros Ghebreyesus. Dr. Tedros, if you would like to sit, to stay where you are, it's fine with us. Very relaxed and convivial event. If you'd rather come to the podium, it's up to you. That's not supposed to be a complicated question.
By the way, I'm not the guest, so if others could speak before me, I would appreciate it.
If you prefer, that's
Yes,
fine.
yes. So please give ministers
Yes,
and also Chris a chance, and then I would be happy to take.
we will have the opportunity to have everyone.
Yeah, because don't treat me as a guest. This is
This is your house.
exactly.
Of course, you're the host. In that case, I will call the lovely Teresa to carry on.
Well, talk about a tease, Dr. Tedros, making us wait to hear you talk. We will wait. So, as you heard in that documentary video, strategic partnerships are very important to the WHO, especially having seen that being strengthened over the years. The WHO has continued to expand collaboration with key partners while also mobilizing traditional and new partners. One of those partners I'd like to call upon Dr. Christopher Elias, President of Global Development Division, Bill and Melinda Gates Foundation. If you'd like to speak from there, you are welcome. Chris.
Thank you, Sabito. And it's a pleasure, everyone, to be here with you this evening. Thank you to the Director General for receiving us in your house, although I think it's actually Dr. Moeti's house tonight. So, yes, we all work for Dr. Moeti. So it is really a pleasure to be here with and welcome ministers, partners, friends, colleagues. You know, like all of you, this week I've received hundreds of invitations. But when I received the invitation from Dr. Moeti to attend tonight, I accepted immediately and told everybody I was committed because this was one of our most important partnerships at the Bill and Melinda Gates Foundation. Has been the past decade of working with Dr. Moeti, and let me put it in context. You know, the Gates Foundation is the largest philanthropic organization in the world, but the highest proportion of our investments are in sub-Saharan Africa. We have significant investments here, much larger than any other region of the world, for many reasons, but partly because of the important partnerships we've been able to forge over the nearly 25-year history of the Bill and Melinda Gates Foundation. And we invest in this region both directly. We currently have 4 offices on the continent. Historically, we've had offices in Nigeria, Ethiopia, South Africa. We just opened an office in Kenya, and later this year we'll open another office in Senegal. But we also work with many, many partners through Gavi and the Global Fund, the Global Financial Facility, and the World Bank, and importantly through the Global Polio Eradication Initiative, where I have the honor to chair the board, the Polio Oversight Board, with Dr. Tedros of the Global Polio Eradication Initiative. So it's no surprise that in our partnership with the WHO, which is the second largest recipient of funding from the Bill and Melinda Gates Foundation, and for those of you who were at the investment case yesterday that was launched with Dr. Tedros, if you looked in the appendix, we're one of the largest funders, we're certainly the largest non-state actor funder of the World Health Organization because of its important role in advancing the health of everyone on the continent and throughout the world, because of the unique role that it has played in so many things that are being debated today this week at the World Health Assembly. Within the WHO, we have a particular important partnership with the Afro region, and we've been pleased to work with the Afro region for pretty much the entire history of the Foundation's engagement here in Sub-Saharan Africa. But that partnership really was turbocharged 10 years ago when Chidi stepped in as the regional director. We had the pleasure of working with Chidi in many issues, and we've forged a relationship the way that one does by rolling up our sleeves with many of you to work on important initiatives. I've been as the chair of the Polio Oversight Board to co-convene, as we've done yesterday, today here at the World the South Assembly and at the various regional committees and at the UN General Assembly, meetings with many of you ministers to talk about some of the key final challenges in the polio eradication effort. Today we met with the ministers from the Lake Chad Basin. Yesterday we met with ministers from outbreak countries in West Africa and Sahel. And really looking at how we can improve the functionality of that complex partnership that is the Global Polio Eradication Initiative, and how we could work here and respond to the challenges of the various ministries. I've also had the pleasure of traveling with Dr. Moeti to a number of key countries. Last year, we traveled together to Mozambique, where the Mozambique and Malawi and its neighboring countries were responding to the only outbreak of wild poliovirus that had happened since the region was certified wild poliovirus free back in 2020. We visited there. We were very happy this week to celebrate with the ministers Chifande and Tiago the fact that that outbreak, the only outbreak of wild poliovirus outside of Pakistan and Afghanistan in the last 8 years, was officially closed by the WHO last year. Similarly, this year we traveled to Madagascar, where again there was an outbreak of variant poliovirus type 1. We were happy that, I think when we plan our visits and we tell people we're coming, then by the time we got there, they hadn't had a case in 6 months. And we celebrated the progress that was made in Madagascar, as well as provided technical discussions around the importance of strengthening surveillance so that that outbreak could be closed as well. So I've had the opportunity to work very closely with Dr. Moeti to see how important her leadership has been. You all know this because you also work with her directly. When she first came in and articulated her transformation agenda, which was summarized in the video, we became partners again to support that transformation agenda. One of the things we did to help her to help support the assessment that she and her team did of the country staffing needs in each of the over 40 countries of the Afro region. That was, in some ways, I think, an exemplar that may be a predecessor to your initiative, Dr. Tedros, on core predictable country presence, because I think 10 years ago, she began to have those kind of conversations country by country here in the Afro region. So we have many things to celebrate this evening. Earlier today, when we're meeting with the Lake Chad Basin ministers, Dr. Moeti said that she remembers, 2020 was a dark year, but the highlight of that year for me was in August of 2020, we both joined the certification commission and saw the Afro region certified wild poliovirus free. I happened to be sitting in my basement watching on the video, but the group in Brazzaville was dancing in the aisles, quite literally. And Dr. Moeti challenged us today to finish polio before the end of her term so that we can do this again. And so all of us need to get together in that partnership to make that achievement. In closing, I would just say that the Bill and Melinda Gates Foundation looks forward to continuing our strong partnership with WHO. I was able to participate with the DG's invitation in the launch of the investment case today, and to wish the organization a highly successful investment round, its first investment round to conclude in Brazil later this year. And we will continue to work closely with the Afro region and the new regional director once they're elected later this year. And I think, the past decade has been transformational. But if you look at the issues that are on the agenda for the Assembly this week, we need the next generation to be even more transformational, given the fiscal constraints, given the rupture of trust that happened during COVID-19, given the emergent conflicts and humanitarian situations across not this continent, but the world. We need the next decade to be even more transformational. I just want to thank Dr. Moeti for giving us the very strong foundation for building on that to achieve the kind of change we all want to see the health of all the people in the world. Thank you.
so much, Dr. Elias, because I was actually thinking that I'm thinking the long walk to freedom here, Nelson Mandela, when I talk about elections earlier on. And there are always milestones that you look back on, the successes, the challenges. And just to echo some of what you're saying, uh, halfway down this program, Dr. Moody, you noted the 12th general program of work on communicable diseases, non-communicable diseases, promoting health through the life course, health systems, preparedness, surveillance and response and corporate services, and enabling functions to promote institutionalization of the agenda of strategic actions or work streams were actually defined in the GPW12 as a result of the work that was done by the Africa region. So, as regional director, I'm sure you're going to reflect on some of the successes, but I want to go back to the point I was trying to make last year. I tried to explain the concept of um, women. What do they call it? Work Wednesday Woman Crush, something like that. Anybody know what is it again? Woman Crush Wednesday. That's it. See, it didn't go over somebody's head. And guess what? It's Wednesday again, Dr. Moeti. So it means I get a second time around. And I would like to all ask you to stand. Please give a warm round of applause. You can speak from there, Dr. Moeti, as she gives her review of the last 10 years. The Regional Director of Africa World Health Organization, Dr. Matsidi Moeti. Thank you very much. And I know that would probably annoy you, Dr. Moeti, that I did that, but I just had to do that.
Thank you very much to our moderators. It's a piece of Ketlahoborn, as I said. I'd like to wish a very good evening to everyone and thank all the illustrious previous speakers. Thank you so much, Austin. Thank you, Chris, for, so I'll be formal and not say Honorable Minister Austin. and just remind everybody that we knew each other many years ago when we both worked in Zambia, in Malawi. In Malawi, I was at the driving force in CDC. So please forgive me if I mentioned him informally, and the same for Chris. Thank you for having joined us and so ably set the stage for tonight's event to showcase the achievements of the ambitious transformation agenda of the WHOAfrica region over the past decade. So again, thank you for being co-sponsors of this event. As Chris said, there are many, many things happening this week. So DG, our transformation of the World Health Assembly is still a work in progress, I guess. But it's a great honor for me, and it's a great honor for my team and our entire team in the regional office in the 47 countries to have this opportunity to share our experience over the past 10 years. I'd just like to say to my two co-sponsors, Dr. Austin, your pioneering innovation in accelerating positive impact on the people's health has been really inspirational, and I hope it continues to inspire some of the changes that we need to make in where they are. And to Chris and the Melinda Gates Foundation, you have been a key partner in the African region's fight against polio, in other priority areas, and on the transformation. A special welcome to Director General, my boss, and also welcome to the representative of the IPO who couldn't make it this evening exactly because the program is so rich. Welcome, Excellencies, Honorable Ministers, dear partners, colleagues, and friends. I deeply appreciate your making time in your demanding schedules to mark this milestone with me and my colleagues as my 10-year term as Regional Director for Africa draws to a close. And I'd like to point out there that my husband is sitting over there and has been waiting. Has been encouraging me, but he and my daughter who lives in London have asked me, when is this crazy stuff going to finish? So now we know it's going to be in a few months. The transformation agenda was born out of a very challenging period characterized by weak health systems in most member states and poor health outcomes, evidenced by our inability to attain the health MDGs. We didn't quite make it at the time. And when I took office in 2015, the African region was responding to the biggest Ebola outbreak in history, struggling to contain the wild virus outbreak, as well as facing down increasingly negative sentiments related to overall management and the lack of accountability and compliance with WHO. So to reignite trust and pride in the organization, the need for reform and new priorities was urgent, and I felt. The transformation agenda, which resulted from extensive consultations, including with some of our harshest critics who I invited to our table, provided the roadmap. So the TA roadmap focused on setting up a robust system for improving the accountability and efficiency of the Afro Secretariat. So in a way, starting at the other end, much of the time when we talk about programs, technical programs, health programs. So we initiated part of the work on improving our management. We're being asked to do that. This was supported. So we established a robust system for improving accountability and efficiency, supporting this with consistent monitoring of our admin, financial, and human resources management. Of course, the roadmap was importantly focused on ensuring quality support to member states' progress in key health technical areas and on improving health outcomes for the people. I have to confess that I was determined that my colleagues and I would never again have to explain poor audit reports to regional and WHO governing bodies. I think we achieved that until something just happened this year. But 10 years on, we're pleased to provide some feedback and to report back to our countries, to our partners, and to the people in the region. WHO's offers restructuring of an investment in country offices to be fit for purpose, did functional reviews, as Chris had said, and thank you for the support for that. The establishment of multi-country assignment teams that are placed to cover 4 or 5 countries with a group of international staff of high quality to support country action. And a huge investment in management improvement helped to deliver the achievements that we are presenting today. So to effectively monitor our performance, managerial key performance indicators were developed and introduced in all our country offices and departments. These KPIs were linked to corrective action when gaps were identified. So we took the time to identify where were things going wrong and immediately established a team that would provide the support to improve. And that, I believe, what has given us the ability to say we have had very few negative audits for a number of years in Afro. So we can boost of improved audit outcomes and better management of human resources provided to our region. Pleased that these key performance indicators have inspired the approach to accountability in WHO's global transformation. The other thing we really were keen to do was to improve gender parity in our staff, especially among senior and mid-level. That was one of my priorities in the TA. And 10 years later, there are more senior women managers leading the WHO in the African region than any time. Through the UN Volunteers Program, we attracted over 200 UNVs. 80% of these are young public health experts who are women. And we believe that we are setting up a pipeline for gender equity staffing of the organization. I'm starting with this because I think it's extremely important. It's not detail. It's not something we tick off when we're answering the executive board. It makes a difference in the way that we do our work, and we were absolutely committed to it. Thank you to my team who have supported this work. We also invested in improving leadership skills among our staff. The WHOAfrica Pathway to Leadership Training and Mentorship Program informed the global WHO leadership program and has been to build capacity and leadership in other WHO regions. So we're very pleased to have shared that with the rest of the organization as well. We've partnered with academic institutions on the continent as a way of making the program widely available beyond WHO and ensuring its sustainability. I'm also proud that this program has been offered to senior managers in several of our member states. So we shared our capacities as we went along this journey, making sure that as we improve the quality of our leaders, the same is happening in some countries. And we have now the opportunity to do that with some training institutions in the region. Investing in our human resources also entails staff signing up to the values of the organization and regularly communicating the need to create a respectful and fair work environment through town hall meetings, discussions with teams at different levels was one of my priorities. Full-time ombudsman is now available to help to resolve conflict in the region in a timely way, because we're working on creating an environment for all our staff to deliver of their best. So I'm starting with these aspects of our work, as I said, as opposed to the programmatic public health. We were determined to be the kind of workplace that people want to be in and to be a trusted partner, responsible partner to our governments, our nations, and our partners. And I hope we have managed to do some of that. So what have been some of the achievements as far as public health is concerned? Our shared vision of health security, equity, and universal health coverage for all people in Africa has stood strong, despite the many challenges we faced, such as multiple disease outbreaks and emergencies, not least of which was the COVID-19 pandemic. That we're facing climate change related natural disasters, and some of these already been mentioned, the re-emergence of imported polio as a health threats, and very much the emergence of non-clinical diseases in the region. The successes have been varied, as have lessons learned. And of course, we recognize that there is still much to do. In some areas, progress has not matched our ambitions. But in relation to our technical work, I will highlight some views which I've grouped according to priority programmatic areas. One of the biggest pushes has been to enhance public health emergency prevention, preparedness, and response capacity. This has been a central conversation during this World Health Assembly, we will acknowledge, so that it's a global issue, but we did a lot of work on that on the African level, because we have the background of multiple outbreaks, is already said, Ebola, Marburg, yellow fever, and cholera, among others, and so much of our focus. We've seen significant reductions in the average time for detection of outbreaks from 40 days, and 40 days is an average. Sometimes it takes several months. In the past, it took several months to recognize that an outbreak. Now, this average is only about 4 days. So that reflects better management, the preparedness, and that capacity has been built through our support, working with partners in our member state. We supported the training of over 3,700 first responders that were mentioned by the Minister of Sierra Leone, who are ready to their jobs. So when they're not responding to outbreaks, they're doing something else. The government getting jobs. But I've been very pleased to meet them when I've visited countries where the disease outbreaks, they say, 3,700 have come from a neighboring country to provide support to an outbreak here. So this is building regional capacity. This is building capacity within the continent. Of course, we know that there are international mechanisms for providing responders, but we thought it was very important within the country to have this capacity and within the region close by to be able to exchange. And this is something that we need to continue. We've also leveraged our genetic sequencing and laboratory expertise from across disease programs. I recall working with the colleagues from the program, from the influenza program, as we raced to build the capacity for genomic sequencing in our countries. And we did manage to do that in a relatively short space of time. So that emphasizes the importance of working across programmatic boundaries when the needs are there. And this is something that I hope we can adopt as a strategy to pool resources when they are needed across specific programs. So the capacity that we have created and the platform that's been established by the African Union and the African Sequencing, we believe is now going to be available for our region going forward into the future. It's one of the results of the very challenging response to the COVID-19 pandemic, but also rests on capacities that had already been built in response to other programs. The sub-regional emergency operations hubs are proving their value. So we established these just after the Ebola outbreak in West Africa, and they have now been transformed and are really delivering. For example, emergency supplies of the type that the Honorable Minister was referring to can now be delivered in as little as 4 days, down from about 45 days previously. We intend to continue to reduce this further. So we have, in a relatively short space of time, building on what had been going on in the past, spurred on very much by the COVID-19 pandemic, invested hugely in our capacity to help preparedness and response to disease outbreaks. So my visits to many emergency affected countries and communities, for example, in Angola, in the Democratic Republic of Congo, Madagascar, and Mozambique, have left me heartened that our support is having a real impact in terms of lives and livelihoods saved. Now, our efforts to control and eliminate communicable diseases have also been seen meaningful success. For example, with millions of people in Africa vaccinated against COVID-19, against significant odds. We talked a lot and worked very much to address the inequities there, but still, it was possible through our work to avail vaccines to many millions of people in the region. The introduction to routine immunization of a new vaccine against malaria in Ghana, in Kenya, Malawi, and Cameroon is another big step forward. And we are very hopeful that it, combined with other malaria interventions, it'll transform the situation of malaria, which is such a big killer of us on the continent. So we were very much involved in trying that out and supporting countries. We are very encouraged by the progress made against neglected tropical diseases and know that our expanded Spencer project for the elimination of NTDs, so-called ESPEN, which was a really small, lean, but extremely effective team within the NTD program, has played a central role in the NTD progress. The first data, which includes interactive dashboards, maps, and data sets, is already providing valuable information, informing actions through national NTD master plans and annual work plans and partner support. The results speak for themselves. By the end of 2023, 19 member states had eliminated one NTD, and Togo, I saw the Honorable Minister of Togo somewhere along there. Togo had become the first country worldwide to eliminate 4 NTDs. So we congratulate. Donc, félicitations, Monsieur le Ministre. Congratulations to all the other countries where there is tangible progress progress in the elimination of neglected tropical diseases. Marked progress was also made towards controlling HIV. We established with our headquarters a special initiative for the Western Central African countries that were lagging behind in addressing HIV, and we've seen tangible progress here as well. The elimination of mother-to-child transmission in Botswana, in Namibia, and Eswatini is a special cause for collective celebration. This, of course, is an area in which we worked with many partners as well. Polio, meanwhile, is an important success story for the African region. It's already been indicated by Chris. It's impossible, and Chris, I apologize to you in advance, not to recall Dr. Elias when he took office, when he met me in Geneva. He took me out for dinner. He bought me a glass of wine. As I tilted it to my lips to have a sip, he said to me, "You have a lot of catching up to do and a large number of relatively unaffordable long-term contract polio staff. What are you going to do about it?" Okay, I didn't choke on the wine. It was a very close thing. Our friendship and partnership has evolved since in terms of the support that the Bill and Melinda Gates Foundation has provided to us. In response to his challenge, I reorganized the polio response program and placed the unit under my direct supervision and coordination. We worked with partners to introduce innovative technology such as GIS to support the response to polio, and some of the innovations created other programs. We've worked very hard to achieve eradication, and as Chris, we done 2020 when this was declared in the and earlier this month, experts confirmed that the World Poliovirus 1 outbreak that Chris alluded to in Southern Africa has been closed down following importation in 2021. So that was a huge collective effort of the countries, of the polio partners, and of the people. I'll emphasize people in these countries as well. So this is thanks to a robust collaborative sub-regional outbreak response, which is also contributing to progress towards addressing the circulating vaccine-derived poliovirus in many countries. As Chris said, we've had 2 conversations already with groups of countries that are affected by this. And we've already seen enormous progress in addressing this in the last couple of years. And this is work that was started while the COVID-19 pandemic was going on. So thank you, honorable ministers of those countries, for your leadership. And thanks to all the polio partners again for this work that we've done together. We, of course, played an important role, we think, in interrupting COVID-19 and down and slowed down by insecurity in countries. The polio eradication effort is regaining momentum. Again, thank you to the ministers and the leaders of the countries who actually sit down in meetings and talk about polio. But I'd like to say the real lesson to us is the power of collaboration as we engaged everyone from politicians to community members, combining evidence, science, innovation, and implementation to protect our children from this devastating virus. The health of Africa's mothers and children takes precedence in everything that we do. I'm pleased to be able to share some of the mutual support member states to develop, resource, and implement high-impact integrated interventions in yielding results. Statistics show a real life speed. 7 of our countries have achieved the relevant SDG 3 targets, while 30 reduced their maternal death rates by more than half in 2 years to 2020. So progress is actually happening. But we know that there is much to do about equity. Maternal deaths remain highest in whether protracted conflicts and humanitarian crises in rural areas and in the peri-urban slums just under our eyes. So we need to pay much more attention to equity and organize the services so that they reach those that need them most. we are adopting our strategies in WHO. And turning now to universal health coverage, we started supporting member states to develop UHC roadmaps several years ago. And the Health Coverage Service, which covers several indices to track universal health coverage, doubled from 23 in the year 2000 to 46 in 2019. And although our progress has been modest, it's encouraging more people in the African region can now access essential health services. The threefold increase in the number of health workers in the region from 2013 to 2022, notwithstanding the great challenges that remain in terms of out-migration or unemployment, underemployment of qualified staff, has also contributed to improved service coverage. In March this year, in Geneva, in Namibia, we launched a pioneering health workforce investment charter, a first for the African region. And its aim is to consolidate efforts to drive up investments to counter the critical health worker shortages that remain in the region. The charter is a critical complement to the deserved focus on trained, remunerated community health workers with career prospects, something that's attracting a lot of attention today. So we need not only community health workers, we need health workers who are motivated, well remunerated, and able to provide care from the primary care level right up to the central level. We are working with our members. This potential example, the signing of this charter, of governments, partners, and different stakeholders working and investing together, should send as a reminder to us all of the multifaceted responses that are crucial to maintaining and accelerating the gains that we've made. So we know that the issue of migration of healthcare workers is a complex one, and we are hoping that having this platform for engaging countries, not only in the region, but other countries as well that gain from the migration, can help to ensure that the investment by both governments and hopefully by governments that gain healthcare workers from Africa can be done in a way, and we can cover the gaps that became very important, particularly after the COVID-19 pandemic. To increase access to quality medicines, just another example, we supported countries to build their capacity for regulation. This is extremely important. So national regulatory authorities in 4 African region countries have achieved maturity level 3. We expect this number to increase to at least 7 by 2025. This is critical to the very important issue of local manufacturing of medicines that has become a priority at the continental level, triggered and pushed by the difficulties that Africa experienced during the COVID-19 pandemic. And yesterday, I was very proud to join the Honorable Minister of Mauritius, I don't know if he's here, to witness the signing between the Ministry of Health and the pharmaceutical company in part of our pooled procurement of medicines in all island states. So on their own, and I'd like to share that what the Honorable Minister for Seychelles, and we were discussing this at the meeting that we had small island states in the Seychelles. It has taken several years of consistent work. It has taken the willingness of the countries to compromise in terms of their standards, their rules by which they procure medicines to reach the point of the signature that happened yesterday. And in WHOAfrica and in these countries that we have learned many, many lessons about what it takes to carry out the kind of procurement that we are expecting to be driven by the African Medicines Agency that has been established by the Union. So our smallest country have got a lot to offer in terms of learning to the bigger countries. And we are very pleased to have taken that road and had that experience with you. And we are anticipating that countries that are normally not in the market because the volumes are too small can be able to reduce by 50%. That's what has happened in this example of Mauritius, the cost of medicine that they have. And that is an experience that WHOAfrica has to offer at the global level and to the African Union and the continent. So we know that member states still face health financing challenges, and working with partners, we've supported at least 36 of our countries to introduce some form of health insurance scheme as a way of mobilizing additional resources to drive their national health agendas. And this will now encourage you to also encompass the contribution of the private sector so that we can reduce the number of people who have to pay out of pocket directly when they seek healthcare, which is a very big number, a high proportion in some of the countries. I don't have to go into those examples. These are some of the contributions that we are making in supporting policy and the development of financing plans. Coming now to a few examples outside of communicable diseases, we have seen very significant improvement in road safety and tobacco use. So these are some of the drivers of illness in the region. So both areas have seen good results. So in the past 10 years, 17 of our countries have halved the number of road traffic-related deaths, and 22 of the 56 countries globally are on track to reduce tobacco use by 30% by 2025 are in Africa. So even there, dealing with the determinants of health, we have made progress in the decade. We had an innovation initiative in Africa, and we launched it several years ago and discovered how much talent, how much innovation among young African health scientists exists, which is untapped. So we are supporting countries to develop an ecosystem for innovation so that the clever ideas of African experts can find traction, can find financing, and can be used as approaches to address health problems in the region. And we're very, very proud that one of the that we identified developed a portable device that uses artificial intelligence to verify drug authenticity, and he was honored by Forbes 30 under 30 in 2020. So we've been able to identify some clever, innovative people, and this is an area that we would like to appeal to countries and governments and partners to invest. There's lots of talents in our young scientists and we need to be encouraged. We have to be. So to try to conclude, I'm being told my time is up. We've tried to show you in several areas, in communicable diseases, in dealing with disease outbreaks, preparing for them, responding to them, in maternal and child health, in non-communicable diseases, which are fast emerging as a new problem. Some of the work that we've supported member states to do in the African region. So I'd just like to add that looking for the 10 years of the transformation agenda, I can confidently say that the WHOAfrican region has built a robust system for ensuring continuity and an accountable system that focuses on a person-centered approach. Thank you, Austin, for having really inspired us in that direction, because we believe not only is it important to do primary healthcare, we really need to shift to at persons and take every opportunity to provide them with information that they need to prevent illness, with services that they need to preserve their health across the life course. So this is something that I'm leaving to my successor as a tangible project to take forward, because we are starting to see it can be extremely efficient in producing health impact. So that's one thing I'd like to encourage. We also know that we've improved our efficiency, and I would like to encourage going on in that direction as well. The progress to date would not have been possible without political will at the highest level and the power of at the level. We need to accelerate collaborations to move the continent forward. And although I'll be watching the jazz festivals across the world, tennis tournaments, which I've only been able to watch on TV, now I'll be able to go in person, I hope, and also be engaged in some health work. I know that I anticipate that there'll be continued growth in our regional partnership with global health players, including with our diaspora, another potential capacity that we could leverage further. Innovation and use of technology will increase and result in more efficient delivery of services, and that the private sector's role in health on the continent will expand and complement what our government is able to do, and that more investment and financing for universal health coverage will continue to grow for member states to fully attain universal health coverage. I'm convinced that our continent will manufacture more of the tools that we need for health. We've already started, and we'd like to encourage that this continues. So I'd like to end by saying a thank you to everyone who has accompanied our transformation agenda. I'd like to say thank you to our partners, those who have worked tirelessly alongside with me, staff, including my deputy, our staff in all the countries, our WHO representatives, and those invisible staff members who are in the background. We never help. Believe me, there's a strong team behind some of the people that you see in conferences and assembly. I'd like to end by thanking you all again, honorable ministers and your teams for working with us, and most of all, my husband and my family for having tolerated my absence. And I'm ready now to assume. I'm ready now to assume my family responsibilities, but most of all, would like to say it's a great honor to serve the continent as the regional director of WHOAfrica. Thank you all very much.
Your Excellencies, Honorable Ministers, honored guests, Dr. Matshidiso Moeti. What you have just seen is the absolute definition of being caught between a rock and a hard place. Our sweating bullets. I needed to say that I needed to interrupt my boss to say her boss to say a word in support. So without wasting too much time, I am not sure if you'd like to sit, Dr. Tedros, if you'd like to come to the podium. Ladies and gentlemen, honored guests, Your Excellencies, Dr. Tedros Adhanom Ghebreyesus, the WHO Director General.
Thank you. So you were laughing earlier when I said, Hula, Hula. What happened? Dumala. Okay, see, now she said. Yeah. So, first of all, congratulations, my dear sister, for the achievement. I endorse the report. You just reported. Easier for me. I had a speech, but it's no longer valid now. And we converge on many of the issues, she said, almost all. So no need to read the speech, but I would like to say something. First, thank you to Austin and Chris for hosting this evening. Then, on my sister, one thing which is clear from the report and from my time with her over the last 10 years now, by the way, because it's not as the DG, we were working together also when I was Prime Minister, especially Ebola. So it's almost 10 years overlap. So it's almost the whole range. You remember now? That's what you. So there is the 3 years when I was Prime Minister, and then there is the 7 years when I'm DG. And what I have observed since the first time I met her was her belief in change as a constant. And what you have seen, for instance, I can cite some examples. Immediately after the Ebola, the reform she has done in the emergency program, and then believing in capacity building, the leadership program she has, and then the reform in values and cultures, and that's few. And actually, what started in Afro by her helped us also, and some part was the basis for the global transformation agenda we started. The 7 thematic areas and more than 50. So that's very clear. And then the other, not only a belief in change, but she's very hardworking and including hurting herself. And she wouldn't even listen when she's in hospital. And her husband was in trouble when they they take mobiles away from her and she takes it back because she had a serious health problem recently, as you remember. And even then, this is a serious issue, but she wants to work. And that also is something that impresses me because she knows she's sacrificing herself, but she continues doing it. She knows she hurts herself, but she doesn't. And she doesn't listen and very stubborn. And I don't know how the husband is. Then um, the 2018 collaboration, 2014 collaboration, when I was foreign minister in Ethiopia, you may remember we contributed health workers, and even almost many countries in Africa contributed funding as well, including Ethiopia, some money, some token. And that was the area where I was trying to support because although I was foreign minister, I had the Minister of Health hat still. And I believed in the role of the foreign ministers also to contribute to this. And then fast forward, as soon as I became Director General, it's like 2018, the Ebola in the RC started. And very unfortunate, from one problem to the other. The 10 years of her tenure, actually the most difficult. Mine is also difficult because we overlap 7 years, but the most difficult. I don't know if she had any break, to be honest. It's um, then 2018, of course. One thing I was happy then was we agreed on one issue. We said, you remember, and with colleagues also, Michelle Yao is here, and Salam is here, Mike Ryan, I don't know if he's here. We said we can contain the Ebola because we have the tools. And then some partners say, you're wrong, you cannot contain. WHO is getting out of control. So they. And they told us to be realistic. They said, no, no, we can contain it. And we have been to the field many times with my sister. And we were convinced that we can contain because we have it. Of course, there was even a serious criticism, by the way, from I don't want to name. Finally, of course, after 2 years, it was contained, thanks to the government, to the community, to the health workers, the partners. Everybody contributed its best, and it was controlled. And this is to her credit. She was a very strong believer that saying we can contain it. You remember some cases crossed to Uganda, but were export, not it couldn't establish transmission in Uganda, so it was basically in DRC. And she has that determination. Of course, she has said all the programs, improvement in polio, polio elimination in many countries, malaria progress, NTD progress. Thank you to all countries. Of course, this is uh, what do you call it? Credit to you, but the role has been great. Maternal mortality rate improved, under 5 mortality rate improved over the last 10 years, and many good indicators. And I would like to use this opportunity to thank tremendously. This is one chapter closing, but I know she doesn't rest. And she will continue to do something else. And the husband is in trouble. And he's saying like this. But there is nothing you can do. It's in her DNA, so you cannot change the DNA. So you have to give up that. So she's not retiring. She's changing at time. Refiring, refiring. Okay, refiring. Then on, by the way, on the entities, for instance, she recognized Togo, she recognized many other countries, Namibia also, many things, I think. And I saw you a few weeks ago giving the certificate. I think it would be good if we should recognize the elimination programs in during the assembly, the margins of the assembly, because it will motivate many countries and they will be visible as well. This is a global issue. Elimination is a global issue. You know, when I saw you with that picture with Chungula, the minister of Namibia, um, that's what I thought. Maybe bringing it to the assembly and celebrating all of us together, closing the year with good news on elimination of many countries are really committed to doing it. I think would help. And then the last part, I don't want to take more. I have another event, by the way. If you say walk to freedom, yes, Madiba. You know, I would remind him something. I think it's 1951. He was flying to Ethiopian Airlines from the west to the east. I think to Ethiopia. That, by the way, he was trained and armed as well. For those who don't know. Then he took a flight, and I will quote what he said. Here, he says, I experienced a rather strange sensation. As I was boarding the plane, I saw that the pilot was black. I had never seen a black pilot before. The instant I did, I had to quell my panic. How could a black man fly a plane? This is a direct quote from that. I read that book and I remembered, and that's why when you said that, I tried to um, get it because everything is. And the reason I said this is there was a message from Mandela. Also. He said, "We are our own enemies." You know, while anything is possible and we are able to do anything, we lack the confidence. That's what showed me. He said. So the enemy is not out; it was in, and which is a big lesson. And anything is possible. Whether we see polio eradication now, or many of the entity eliminations, significantly cutting under 5 maternal mortality, democracy, freedom, everything is possible. Anything is possible in Africa. And some countries have done it, and they're doing it, and it's possible. When you said that, that was what it reminded me. Africa has a bright future. It can develop, it can progress, it can democratize everything. It has everything. And that's what we should do as a continent. And thank you, my sister, for reminding me. Flying a container is the easiest. I think anything is possible. At the time, it was seen even by him as a difficult issue. But I was so happy that he's a very, very honest man and he shared that experience. He showed his own weaknesses. So the key is understand our weaknesses, improve and move on. And Africa would be better. And I was lucky actually to have to participate in 2063, the Africa We Want strategy when I was Prime Minister, and which I still cherish. I think the Africa We Want can be a reality. The key is to believe in ourselves as Madibas. Thank you so much. Pula now, yeah? Pula. Thank you. Thank you. And all the best to my dear sister and the whole family. And once WHO, always WHO, don't forget that wherever you are, and we will continue to exploit you. Thank you.
Thank you very much, Dr. Tedros. I believe you do have to leave, so if I could just request that we give the Director General an opportunity to leave the building, so to speak. Thank you very much. Ladies and gentlemen, please give him a warm round of applause as he steps out. Does that mean you've changed your mind, Dr. Tedros? Oh, we were hopeful, but here we are. Thank you very much to the Director General of the WHO, Dr. Tedros Ghebreyesus. At least you know you have been informed that you shall continue to be exploited. So open yourself up to that reality and accept it. That you have heard, I think permission was being requested at that time, that every now and then we'll be knocking at these door and saying, Rewe, can you please have Mamueti for a second? So, colleagues, if we could just wrap up this session. I know there are a lot of you who would like to share your contributions, reflect on the journeys your various countries traversed. Some of them Dr. Moeti pointed out, some of them did not. But there is going to be an opportunity, a much more informal segment later on. But for now, we have identified certain countries. This is not to say anybody's contribution is not as important, but just on the journey of the transformation agenda that Dr. Moeti has pointed out. So we realize that there have been a lot of successes. There are some challenges to still look at, just to reflect on Cabo Delgado, for instance, looking at what they've, Cape Verde rather, what they've achieved in terms of ending malaria. The Democratic Republic of Congo, decentralizing health systems and services. In Kenya, for instance, achieving universal health coverage. And Uganda, preparation in case of outbreaks. So this is the time when we're going to engage the various ministers. And if I could just ask you to indulge us as we engage them, and later we will have an opportunity to engage with what they did and perhaps expand on some of those. So perhaps this is the opportunity to hand over to my colleague, right?
Yes, absolutely. Thank you, Tepeso. So for those of you who speak French, please just stay put. And for the rest of you, if you need headsets, because this conversation will be mostly in French, I invite you to just manifest yourself and either get a headset outside or ask for the staff outside. So now we will start with Cape Verde. I'm very pleased and honored to have the Ministry of Health, Madame Filomena Gonçalves. We will speak in French because my Portuguese is really poor. I don't want you to. I'd rather speak in French. We were very impressed. As the RD said, there are so many achievements to celebrate, so many achievements on the continent that is always portrayed in a very way, if you could say so. So we're very proud to have you guys here and to talk about your experience, to share your experience. So about malaria, could you briefly tell us the three most important results and factors that contributed to this historic achievement in ending malaria? Je le dis en français maintenant? Ça va? D'accord, je vous en prie. Donc, je vais vous passer mon micro dans ces cas-là. C'est bon, c'est parfait.
Muito obrigada.
vou parler português. É com grande honra que partilho o sucesso de Cabo Verde.
So yes, for the Portuguese, let me just remind our guests, the Portuguese is number 3 on the headsets.
Ok. Com grande honra que partilho o sucesso de Cabo Verde na eliminação do paludismo. É uma vitória que é fruto de um comprometimento sustentado há 4 décadas. O aumento da esperança de vida de 50 para 75 anos é testemunho do nosso progresso nos cuidados de saúde primários essenciais na erradicação desta doença. Em primeiro lugar, destaca-se um universal cuidado primário de saúde. A eliminação da malária não pode ser alcançada sem serviços de saúde primários fortes em todo o país. Nos últimos 4 décadas, Cabo Verde tem feito um progresso encorajador para alcançar o acesso universal aos cuidados de saúde. Por exemplo, a esperança de vida de 58 para 75 anos entre 1975 e esta data. As crianças cabo-verdianas viverão quase 20 anos mais do que a geração dos seus pais. Os serviços básicos de saúde estão disponíveis para a maioria das pessoas. A maioria dos cabo-verdianos vivem a menos de 30 minutos de um centro de saúde. A malária é eliminada através de uma vigilância rigorosa e meticulosa, investigação de casos, gestão de casos e controle de vetores a nível prioritário. Em cada canto do país onde a malária foi relatada ou está presente. Em segundo lugar, a construção de sistemas robustos específicos para o controle da malária e implementar a capacidade para a eliminação da malária requer liderança forte em todos os níveis, desenvolvimento de parceiros e parcerias, coordenação com múltiplos clientes dentro e fora do governo e um compromisso de construir capacidades técnicas, vigilância, laboratório e especialmente controle de vetores. Estamos cientes que a certificação é apenas o início da eliminação da malária. As intervenções que foram implementadas para eliminar as doenças devem ser mantidas permanentemente. A certificação é apenas um compromisso permanente com serviços de saúde de alta qualidade. Todo o governo deve assumir este compromisso e contribuir regularmente para ele. Muito obrigada.
Thank you very much, Your Excellency. We might come back to you later on. I want everyone to get an opportunity to share also their experiences. So please, don't forget what you want to say. I'll turn to your neighbor. Alors, Son Excellence, Monsieur le ministre de la Santé et de la Population du Congo, Monsieur Gilbert Mokoki. Nous sommes heureux de vous avoir ce soir pour partager votre expérience. Alors, again, la directrice régionale a parlé de vous comme un exemple parmi les autres pays. On se demandait comment est-ce que le Congo s'y est pris pour en fait travailler en collaboration avec l'OMS et notamment pour renforcer les besoins et les soins de santé primaires.
Merci. J'éprouve une grande joie de prendre plutôt la parole dans cet événement pour répondre à cette préoccupation que vous venez d'exprimer. Je vais d'abord faire un petit rappel. Dans les années 90, à cause des différentes crises qu'a connues mon pays, les performances de santé ont connu une chute drastique. L'essentiel des acquis obtenus ont été détruits. Pour relever les défis, le pays, avec l'appui de l'OMS et d'autres agences du système des Nations Unies, a organisé les assises de Vaud sur la santé en 2018. L'une des conclusions était de relancer le fonctionnement optimal des districts sanitaires, d'où le concept de revitalisation. C'est dans cet élan que le gouvernement et l'OMS ont formalisé une stratégie dite stratégie conjointe pour revitaliser les districts sanitaires en 2020 afin d'améliorer l'accès aux soins de qualité dans 12 districts prioritaires. Alors, que peut-on dire? Est-ce qu'avant d'obtenir des bons résultats, nous disons oui, des résultats louables qui ont été obtenus? D'abord, du point de vue de la gouvernance. Il y a eu la mise en place des conseils départementaux de santé dans 10 départements sur 12. Avec l'installation des bureaux, le processus est en cours. Et le MES nous a aidé à briefer les bureaux des conseils départementaux par la connaissance et la maîtrise des nouveaux textes sur la décentralisation, y compris ceux de la santé de base. Il a aussi mis en contribution des fonds issus du recouvrement des coûts et du budget de l'État dans la mise en œuvre de la stratégie. Il a aussi encadré les supervisions à 2 niveaux, du département vers les districts sanitaires et des districts sanitaires vers les centres de santé intégrés. Et chaque année, nous avons tenu des programmes pour la revue des plans de travail des districts sanitaires sous la stratégie opérationnelle et reprogrammation. À cette occasion, nous avons créé un système de nomination pour primer les meilleurs chefs de district sanitaire. On a aussi mené la contractualisation des médecins et autres agents de santé. Concernant l'offre de soins de santé et des services, entre 2022 et 2023, qu'est-ce que nous avons constaté? Nous avons constaté la fréquentation des services s'est améliorée dans les centres de santé intégrés. La couverture en soins de santé prénatale dans les aires de santé d'accessibilité difficile a augmenté. L'utilisation des parthogrammes s'est sensiblement améliorée dans les mêmes zones. La couverture en penta-3, antigène de référence, est passée de 68% en 2022 à 84% en 2023. Le rattrapage des abandons vaccinaux et des zéro doses a été effectif. Nous avons aussi constaté la disponibilité et l'accessibilité du médicament, vraiment améliorée. En matière d'autonomisation des communautés, nous avons mis en place des communautés de santé dans 78 aires de santé sur 86 attendues. Il a aussi constitué des pôles de relais communautaires des aires de santé. Alors, quel a été l'apport effectif de l'OMS? L'OMS a réalisé plusieurs activités dans le domaine de l'appui et du soutien, notamment la formation des équipes techniques dans plusieurs thématiques, comme la gestion du district sanitaire, la supervision de qualité, la gestion du médicament, la gestion des finances au niveau du centre de santé intégré et la gestion de l'information sanitaire, qui était très difficile. La formation des membres du bureau de comité de santé sur la co-gestion et les relais sur les paquets d'activités à offrir dans la communauté. Nous avons aussi constaté que l'appui, le MES peut apporter l'appui direct aux directeurs départementaux, aux équipes cadres de districts sanitaires et aux équipes des centres de santé intégrés. La dotation en médicaments et consommables et de matériel. Il a été mis à la disposition des départements des districts sanitaires des consultants juniors. En somme, les 52 districts sanitaires que compte notre pays sont ciblés pour l'accompagnement de l'OMS en vue de la revitalisation. Présentement, 12 districts sanitaires de la phase 1 et 12 autres districts sanitaires sont en transition. Voilà, c'est l'essentiel de ce que je voulais partager avec mes frères, nos sœurs.
Merci beaucoup, Son Excellence. C'est effectivement une expérience complète que nous avons vue là. Et maintenant, ma collègue Pépisso va prendre le relais. On voudrait également alors aller vers un autre pays voisin, la République centrafricaine. Je vois que le ministère de la Santé est avec nous. Please go ahead.
Minister Dr. Service, good evening. Thank you so much for taking the time to join everyone here for this very momentous discussion. So reflecting on what Dr. Mweti was speaking about, some of the successes, she mentioned conflict. Conflict situations are something that prevent many people, health services, health facilities from reaching. Perhaps if you can talk to us about some of the challenges that your country has had in this regard, how you've been able to capacitate yourself, and if also that has been a challenge, the insecurity of securing financial mechanisms that will help you improve, capacitating, strengthening your healthcare systems.
Merci beaucoup. Mais je ne m'attendais pas à cette question. How do you know me?
The third eye.
No, merci beaucoup. I'm really very proud. You parle français. As you ask me this question, I remember vividly three things that really remain in my mind and my heart. Has the impact of governance of Moiti as a regional director in a very complex situation. Many things happen, but spot three things, which on the one hand reflect her character that was described here, but also a very pragmatic, focused, result-oriented approach. The first one, I was working a lot, with with polio and also with the surveillance of Ebola in the eastern part of the country, which was at that time. And j'étais en train de parler français, qu'est-ce qui se passe? Donc, je disais que je travaillais, et donc on travaillait beaucoup dans la partie est du pays, qui est vraiment occupée par les groupes armés. On était confronté au défi de la surveillance d'Ebola parce qu'on avait la crise d'Ebola à Béni, qui était donc proche de la puissance africaine. Et donc, dans ce contexte-là, ça c'est autre chose, mais c'est beaucoup plus un autre cas. On avait à Lindao, est une autre zone à l'est du sud-est du pays qui était très, très, très frappée par l'insécurité, occupée par les groupes armés complètement. Et les enfants n'étaient pas vaccinés. Donc, il fallait faire une vaccination de rattrapage. Avec les collègues donc on a décidé d'y aller. Moi, je devais y aller pour les choses. Le représentant de l'OMS, on n'avait pas assez d'avions. On avait 2 et le représentant de l'OMS était confronté à un problème d'autorisation pour prendre un avion privé. Mais il fallait qu'il vienne avec moi. Et elle a appelé Moïti pour demander l'autorisation à Moïti si elle peut prendre un avion privé qui n'est pas en fait dans les normes. Et Moïti a donné l'autorisation pour qu'elle aille. Elle a brisé les règles. Elle a pris un risque énorme parce que moi je viens des Nations Unies, elle a pris un risque énorme. La mission a eu lieu et quand on est allé à Lindao, tous les groupes armés sont soulevés. Elles ne voulaient pas, ils ont dit on ne doit pas passer. On avait déjà annoncé la vaccination. Les enfants à la base de la maire de la ville venait avec en sanglots. Parce qu'elle trouvait qu'on était en danger. Moi-même, je me suis dit, mais oui, j'ai autorisé le représentant de l'OMS de venir ici. On avait aussi le représentant de l'UNICEF. Comment je vais faire? Et voilà, je coupe là. On a pu vacciner, on a pu lancer la vaccination. On a pu lancer la vaccination. Voilà, Moïti. Deuxièmement, et cette campagne a carrément réouvert les activités de vaccination dans cette zone. Deuxièmement, c'est à propos de la lutte contre le Covid. Moïti a affecté en Centrafrique une jeune dame. Je l'ai vue ici, Roselyne. Roselyne est où? Roselyne est là. Une épidémiologiste qui était à Béni, qui a travaillé là-bas et tout ça. Et nous, bien sûr, on était démunis. Elle a affecté cette jeune dame-là. Cette jeune dame, elle a été décorée par le président. Elle est très bien connue à Bangui. Quand elle est venue, elle a refusé de rester dans le bureau de l'OMS. Elle est venue rester au ministère. Et c'est elle qui allait dans les quartiers avant pour lancer l'approche à base communautaire, le dépistage des cas de Covid, les comorbidités. Et à sa suite, aujourd'hui, on a adopté l'engagement communautaire avec une politique, une stratégie adoptée par le gouvernement en Conseil des ministres. Nous avons commencé à opérationnaliser l'engagement communautaire. Voilà un résultat. Et ça, c'est Moïti. Troisièmement, récemment, elle a donné l'exemple des surges, des trucs, les systèmes de renforcement de capacité des pays et du continent. On a mis en place l'équipe surge qui est aujourd'hui, même s'ils n'ont pas encore voyagé, qui est vraiment devenue une sorte d'armée de salut et qui intervient à travers le pays pour la vaccination. Voilà, je donne 3 exemples de rôles très clairs et qui ont marqué la République centrafricaine, qui ont marqué le gouvernement à propos du travail de Moïti. Je suis très fier d'elle.
Thank you so much. Thank you so much, Minister. And I think really important examples. And I'm sure we'll hear more such stories. What I'd like to do now is to bring in the partners. They spoke about as partners. I'm very passionate about that. If it weren't people like the WHO, like the Bill and Melinda Gates Foundation, JHS, I personally would not have been able to do the work that I want to do as a health activist, particularly in MNCH and SRH. So let's call on the partners. And I'd like to introduce now, and I'm hoping that the AMREF CEO is here, Dr. Kitai. Oh, there you are. You come in, Dr. Tinji. Hello, welcome. If we could just get you to share your view of the relationship that you had, what what has informed it, the values and the principles, what's driven the commitment?
Well, thank you. Thank you very, very much. And excellencies, friends, first and foremost, thanks, Shidi, for being on the streets with us, the non-government organizations, fighting for the continent of Africa and its dependence on capacity for health security. And many times I wondered whether you're a regional director, you're a civil society activist. But thank you very much for that. And because of that, we made many gains. Today, we must celebrate that SEPI, the board of SEPI, on which I see it, has approved $145 million to support the BioNTech manufacturing plant in Rwanda for mRNA. That's a major, yes, you can clap for SEPI. I think that's a major investment for that. And this, of course, is in addition to Gavi's Africa Vaccine Manufacturing Accelerator, showing that our fight have not been for nothing. So thank you very much, Moeti. We worked very closely as allies on this agenda, supporting the Africa Health Agenda, working closely, mobilizing African ministers for COP28. I don't think that if we did not have your support and the support of your team at WHO, the COP28 Health Day would have been very different last year. And your effort, working with us to mobilize ministers of health to be there for climate change and health was phenomenal. So we must thank you. Africa thanks you for that. We have worked closely on the escaping fight for COVID-19, and you've been a great ally and friend in the hosting of the Africa Health Agenda International Conference, all the way from 2017. You've attended several of them, and your presence has been really great. I remember you summoning me to Brazzaville one time. I don't know that you remember. Give me a friendly tongue lashing on aligning on convening, because I think there was a bit of a conflict with the WHO Afro meeting. I still remember the tongue lashing, but it was friendly, and thanks for being a big sister. You're welcome. The next hike is in March 2025, and you're welcome. But I'm also honored to have actually had the opportunity to present to you two awards. The first award was on COVID-19 leadership, which you shared with Dr. Tedros and Dr. John Kengasong. And the second award was Women in Global Health Leadership Award in 2023, which you shared with many great women. This is because you're a model, you're a champion for women leadership. You talked about this yourself. And also your presence in the Women Lift Board is a really calm and strong wisdom on development of women in health leadership. I must say, you are being the first woman regional director for WHO has made a big difference. This has nothing against the male candidates who are working very hard to succeed you, but your presence has actually been a big support. I joined AMREF exactly the same year you joined WHO Afro, and you are now leaving WHO. Put me under pressure. I feel like I should leave so that I don't become a monarchy, and but I'll seek advice from you. So thank you for WHO Afro, for you, for the milestone that you made. We really, truly, on behalf of the non-government organizations, private sector, and NGOs, we truly thank your open doors in working closely with you. And as Tedros said, allow us to continue to exploit you in Africa. Thank you very much. Thank you.
Thank you, Dr. Katunji. And perhaps just to reflect that friendly tongue lashing, I'd like to extend it to our next speakers. We are running out of time, and we'd like to also offer an opportunity for Dr. Mweti to give the closing remarks. Right?
Yes, we've heard that we have here in the room the former ambassador for global health, former ambassador of Sweden for global health, Mr. Nordstrom. I hope I'm saying it properly.
Very much indeed. Thank you. I'm no longer representing the Swedish government, but still I can convey the appreciation from the Swedish government, what you have done during your years. But we met first time when I was Swedish government in Lusaka many years ago, and you were UNICEF. Then I must sort of also appreciate your courage when you asked me to become the WR in Sierra Leone. I had been the ADG, I had been the acting director general, and then you asked me to become a WR. And of course, immediately I said yes. And that was the top of my sort of life career in global health. So thank you very much for that. Also having the opportunity to work with you on the initial work together with Dr. Usman on the functional reviews. And I've been following that very closely. And from the Swedish government, we provided a little bit of support, not as much as the Gates Foundation, but still seeing the importance, and you started speaking about administration and management. That is what matters if we're going to achieve the public health results. And finally, some of what we did in Sierra Leone, I was very happy to hear the minister speaking about how also what we did investing in the integrated disease surveillance systems that included also maternal mortality resulted in a reduction of maternal mortality with 40%. I was very happy to hear the minister saying that yesterday. Thank you. So very much happy, and I look forward to continue to work with you. Thank you.
Thank you very much. Now, let's grant Dr. Mwete an opportunity to give closing remarks. Before we do that, Ntate Mwete, I want to say something. You've heard these appeals, strange appeals of white come and exploit you. I'm going to request that you get an audio recording of what everybody has said. Lest she be in doubt that she's done enough, you just put on the tape or the CD or whatever so that she can reflect on all of the work that she's done. So that if she even tries to turn the key, she'll remember this is how much ground she's covered. Or what do you think, that Are you still willing to? No? Okay. So let's ask the regional director of the WHOAfrica to please give her closing remarks and word of thanks. Would you like to do it from there, Dr. Mwete?
Right, Dr. Mwete, before you arrive, before you come and gracefully grant us with your closing remarks, I would like to recognize the presence of the commissaire de l'Union africaine, pardon. I'm doing just like Dr. Somsey. I'm starting in English and finishing in French. Madame, nous sommes ravis de vous avoir et nous vous remercions pour votre présence. Pardon, je m'excuse. Merci beaucoup. Merci beaucoup. L'Union africaine a été un partenaire de choix durant 10 années, au cours desquelles le département Afro a travaillé à pied d'œuvre pour réaliser tous ces accomplissements. Alors, je tenais quand même à vous remercier et à remercier votre présence. Docteur Mwete, je vous en prie. Merci beaucoup.
You can give her another round of applause. She deserves it. It's her day.
Okay, thank you very much. Bonsoir, ma sœur. Je ne vous avais pas vu. Merci d'être venue. Et notre partenariat avec l'Union africaine, avec votre groupe était très fantastique et ça va continuer avec le prochain directeur régional, je suis sûre. Merci, merci vraiment pour un partenariat parfait. Zebisa, I just want to tell you that my husband is not called Tate Mwete. That's why he didn't realize you're talking to him. He's called Dr. So, but it's fine. It's okay.
I'll accept the fine.
No, I can tell you. Yeah. So I will be very brief because it's been a long evening and captivating. First and foremost, say all the remarks that were made, all the observations about WHO's contribution to health improvement in the region, I very much share with my team. So I'm somebody who believes very strongly that behind me, I may be the face of WHO Afro, but behind me is a whole lot of people who work day and night very hard, and I'd like to acknowledge them as well. So I'm going to ask them to stand up. Joseph, d'abord. This is my my deputy, Lindy, as well. So Joseph Kabore has been with us from the start. Lindy Makubalo has had the tough job that's still going to go on of trying to reduce fragmentation of the vertical programs and bring everything together to be more efficient. And I hope very much that whoever comes into the region next is going to continue, because I believe it's going to deliver results. I'll also ask the other colleagues who are here to stand up. Kasonde, I see around the room. So if you're a WHO staff member, on your feet, please. So I have a very strong team, very supportive team who have worked day and night to support our countries. We have 47 country representatives and other people working. So thank you for your appreciation for our work under my leadership. Pamela, I didn't see you stand up. Our partnership colleague. Yeah. So I'd like to say my thanks to these people who work day and night and who also probably have their own spouses saying what my spouse says to me every day, that when are you going to come home? When are you going to stop? But really to finish by thanking the honorable ministers, all of you, for your leadership, because it is what you define with the participation of our teams at country level that has led and guided our investments, not only WHO, but all the other partners that work with you. And we have tried very much to be one of those who gathers the partners and helps you have a coherent agenda to which to work with many partners and countries. So I hope that's something that's going to continue. Thank you to all the partners who support our work in different ways, who accompany us, who hold our hands, who provide the financing, who provide the comments as well, who provide the inspiration, who tell us when we're not doing great, and who advise us how to do better, because that's something that we appreciate as well, at least I do very much. And if I can point to one partner that I'm seeing, it's Togo over there, who is, has been a champion leader in neglected tropical diseases, is transitioning. Thank you for bringing me a nice bag of goods from the UK as well. And then finally, thank you to our co-sponsors, not only for having agreed to accompany us in this discussion tonight, but for all the work you do that inspires us every day, that supports our work, that encourages us. Thank you to the representative, to my friend and partner from the Upper region. We learn a lot from each other across the regions, and I hope that's something that's going to continue. And then finally, thanks to the team that's worked very hard to organize this evening. Thank you all for having come, and I'm confident that the work that we've supported, the progress that we've made together will continue even faster based on what we've learned. And we are going to be documenting some of what we have done, some of what we have seen, what we have learned, where we have made mistakes, where we needed to do things differently. So this is a conversation that's going to continue at the regional committee, in the country offices, and our progress and success belongs to you. The countries have done most of the work. Thank you all very much.
Dr. Wood, I feel like we could continue for several more hours just engaging with you on the wonderful work that you've done. And we'd like to bid our audience who are joining us online farewell at this point, because what we want to do is continue the conversation here. So while you have your drinks and your eats, have time to engage in what we spoke about. So this is the end of the formal part of the evening. So we'd like to thank the regional director one more time and offer our congratulations. I know personally, I've said this, that I look up to you, and I am very proud as a younger sister to see the amount of amazing work you've done with such great tenacity, valor, and as Dr. Songs was saying, empathy. So we salute you, ma'am.
Well, thank you, everyone. So as we said, the formal part of the event is now coming to an end. But of course, you guys can talk, you guys can drink and eat, you guys can engage between each other. You guys, as we congratulate again the RD, thank again the partners and the honorable ministers who made the way here. I can see the Minister of Burkina Faso, Minister of Togo was here, and obviously all the guests were here. Thank you all and have a good evening.